Good morning. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern University's Feinberg School of Medicine, who is answering your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. Now, we invite you to submit your questions to us via Facebook or directly via email at globalhealthinstitute@northwestern.edu. Leading the discussion here today is Katie, who is interning this summer with the Institute. Now, Katie, I'd like to turn it over to you.
So much, Kristen, and thank you so much, Dr. Murphy. Welcome all of the viewers. It's so great to have you back. We're just going to quickly start out going over some recent headlines and getting Dr. Murphy's opinion. Starting out, very sadly, there have been very few, but still numbers of teenagers that have shown symptoms of heart conditions or even cardiac arrest following their second dose of the COVID vaccine. What is your reaction, or what do you know about these severe reactions in teens?
Well, kids are very vulnerable to getting all sorts of viral infections that can cause pericarditis or myocarditis, the inflammation of the heart or around the heart. So there's a lot of viruses that do this. So these cases have to be investigated because they're temporally related to taking the vaccine. It's been studied, in a few small groups and reported. And in most cases, it's very mild if it does occur. And people just get better. Most don't even need any treatment. Some do need treatment, and as you mentioned, there's been a couple really catastrophic cases, but they've got to be invested quite intensively, and that's being done. If anybody thinks that they have something wrong with their heart, or the parent is concerned about the kid, of course, seek medical attention immediately. It may be due to the vaccine. We're not actually quite sure yet, because it does just happen in the population, especially now that kids are more, we're told, go outside, it's safe to be outside. But of course, this is mosquito season, and kids are going to get bit by all sorts of mosquitoes and ticks and bugs and everything like that, and they can get exposed to a number of things. So keep that in mind. Overall, it also can occur, cardiac problems can occur from COVID itself. And so you always have to weigh the risk and benefit. If you don't take the vaccine, you're going to be at a much higher risk for getting COVID, and that has all sorts of problems associated with it, including cardiac. So it's a personal decision, obviously, but the vaccine is generally very safe and does protect you from COVID. So you have to take the risks and the benefits together.
Yeah. Another headline that we were looking at is that a lot of countries that we were looking at as examples for proper protocol or quote unquote success stories in their attempts to sequester COVID, like Australia or Spain, are now having to reimpose or impose new restrictions. Do we know why that is?
Yeah, it's because of the Delta variant. The Delta variant is much more contagious than the Alpha variant, which originally was reported as B.1.1.7, originally from the United Kingdom, was doing the most reporting. And it's just so contagious. So if somebody gets infected, especially in Australia, where they have controlled this pandemic remarkably well with pretty draconian restrictions, but hardly any of them are vaccinated. So if the infection gets into that population, it's going to spread like wildfire, and that's why they have to pull back now and put those restrictions back in place until they can get this controlled. But it illustrates the fact that the mitigations are not good enough. That you really have to have protective immunity. You've got to have the vaccine to stop this thing from catching hold in these otherwise well-controlled places.
Certainly. And do you have any updates on the Delta variant spread in the United States?
It's everywhere. Pretty much every state has reported it now. All 50 states, actually. And it will take over here in the United States because it's so much more contagious than the other variants and the other strains of the virus. So it's really a matter of weeks to months before Delta is pretty much the completely dominant strain here. And this happened also in the United Kingdom, and wherever Delta shows up in the population, it takes over.
Yeah. Wow. Well, switching over to some of our viewer submitted questions.
Okay.
Starting first, a fully vaccinated family is taking their under 12-year-old child or have a plan to go to Disney for a trip. And they were wondering if proper masking, social distancing rules are followed. Is it safe for their family to go on this trip?
Well, I hate to be Debbie Downer here, but this Delta thing is really serious, and going to a big crowded place like that is going to carry some risk. Now, if the kid tries to stay away from other people as much as possible and wear a mask, probably everything will be okay. But just keep in mind that that risk is greater than not going there. It's not too bad if you do the masks and the social distancing, keep to yourselves and whatever, and the rest of the family is protected. So where that kid in the bubble that he's really hanging out in, or he or she is hanging out in, at least they're not going to get it from the family. But it's not really a green light yet. It's a yellow light. So if they're going to go, they're going to go. Just be careful.
Proceed with caution.
Yes.
All right. Next, we have, are masks going to be required specifically in elementary schools or for kids under 12 in schools this coming fall?
Well, this fall, unfortunately, the studies in kids 6 months to 11 years of age are not completed yet and are unlikely to be completed before the end of this calendar year. So they're not going to be vaccinated. So they're going to have to continue to wear masks and socially distance if they want to be careful. That's the general recommendation of the CDC. But remember, it is not a mandate. It is a recommendation. So schools are going to do kind of what they want to do. But look what happened at that summer camp in downstate Illinois, where hardly any of the kids were vaccinated, and they had an outbreak with really dozens of people getting infected. So we've got to be careful. The schools have done a pretty good job with this. So I think that in the next couple of months will be the touchy time until the vaccines are approved from 6 months to 11 years. But getting approved doesn't mean everybody's going to take them. If you look at the statistics of kids under 18 taking the vaccine, it's pretty low. Even though it is approved now. So, we've got to, turn that around, and people have to worry about their kids getting COVID because there are all sorts of issues and problems that can happen if they do get infected. Yeah.
Next, we have a person who received their Johnson & Johnson vaccine early March, and that was not her preference for which vaccine to get, but of course, if you have any option to get a vaccine, get a vaccine. She was wondering if it was safe for her to receive an additional 2-dose vaccine for extra protection / peace of mind.
At this point, I would say no, but that could change. And Johnson & Johnson themselves is doing a study looking at 2 doses. They're doing 2 doses compared to 1 dose. That's been going on for many months now. So we'll see what happens with that. As far as switching to the mRNA vaccines, which I'm pretty much, that's the only other option really out there, that's a good question, because the other vaccines do prevent infection that causes like mild and moderate disease better than the Johnson & Johnson. But for severe disease, hospitalization, and death, they're all about the same. And that shows you kind of the different parts of the immune system, like what's happening and what is protecting what. So the Johnson & Johnson is very good at protecting from severe disease, not as good on the mild disease. So anyway, this is all going to play out over the next couple of months. At this particular point, it's really not recommended because it's thought not to be necessary. Now, this person has no underlying conditions. This is probably not true if a person has an underlying condition that's serious, an underlying cancer, an underlying autoimmune disease, somebody who has to take steroids or immunosuppressants for some reason. That person needs a very good talk with their primary care physicians. And by the way, they're going to release the vaccine to doctors' offices. That was a statement that came out in the last week, just to get these vaccines out there, so there's no more hurdles when a patient who has not been vaccinated decides, if their doctor can convince them that it would be a good idea to take the vaccine for the first time, or in this case, to take a different vaccine, you can do it right at the doctor's office. So that's all in the process of happening right now. So the short answer is you don't have to do it yet, but that may change.
Wow, that's excellent news.
Yeah.
And I understand that some studies have been running, looking at the effect or how well T cells are responding to the COVID vaccine. Do you have any
Right.
options or opinions on that?
So you have, there's two broad parts to the immunity, the protection that your body makes. There's the antibodies and there's the T cells, a deeper type of immunologic reaction, where there's memory cells that memorizes the exposure and will tell other cells to do things to protect the body. So anyway, the data are pretty strong now that that protection goes out at least till 10 months and maybe longer. So that's a very good sign. So that's why nobody is saying, oh, you need a booster in 1 year, because we haven't crossed that threshold in enough people to actually, and then see them starting to get sick. We see a lot of people get infected again, but it's usually a very brief infection with either no symptoms or minor symptoms. They don't end up in the hospital. You look in the hospital now, very few people have been vaccinated. A few, but predominantly 95 to 99% of the people in the hospital right now were not vaccinated at all.
Wow. Lastly, this is a bit of a long one, so bear with me. But someone after receiving their first dose had continued pain in their arm, and following your advice on a WGN segment, they spoke to their family practitioner, but unfortunately their practitioner was unsure of what to do next. They're still having those pains from the first site as they had their second shot in the other arm. But sometimes it's so bad that it wakes them up from sleep and it ebbs and flows or can radiate down to the elbow. What further recommendations can you make for help for them? Should they go see another doctor, etc.?
Yeah, no, this can be due to the injection itself. It has been reported before. I've seen at least one case report of this happening. A further, more intense evaluation probably is needed, such as, I'm just saying this is a possibility. I'm not telling the person to do it. They have to do that, make that decision with their doctor. But they do like an MRI scan of the shoulder, see if there's any inflammation or swelling there or whatever. In the one case report that I did read, the symptoms did go away ultimately. But, I think a further evaluation, maybe with an orthopedic person or somebody like that the primary care doctor would refer them to, could do, a more intense evaluation and maybe even some therapy.
Great. Well, thank you so much for answering the viewers' questions. I know they really appreciate it. I appreciate it as well. And I hope everyone has a great day.
Yeah, great. And we'll see you next time, which I think is tomorrow. All right.